Hello, welcome back to my channel. I am Nurse Marsha, a retired nurse with over 30 years experience. Today, I want to talk to you about the most common health issues that people are just too embarrassed to speak to their doctor about. And I'm also going to give you some tips on how to talk to your doctor about those embarrassing health issues. So, what is the number one health issue that people are too embarrassed to talk to their doctor about? It is sexual health concerns such as erectile dysfunction, painful intercourse, and sexually transmitted infection or sexually transmitted diseases. Moving on to number two, mental health concerns. If a person is feeling sad, having crying spells, they feel like there's no need to keep living, they feel embarrassed to speak to their doctor about these type of symptoms. And they also are very concerned that a doctor is just going to lock them up on a mental health unit and throw away the key. The third most common health issue that people are most embarrassed to speak to their doctor about is body image, distorted body image. Some of these body images are real and some of them are not. Such as if a person is overweight, they might want to talk to their doctor because they may want help in how to lose weight. They may want to be medicated with a medication that can help suppress their appetite. Some people are too thin and they want help to learn how to gain weight the proper way. Some people have distorted images that will cause such health issues such as anorexia. Number four, body odor issues. Even though a person may shower 2 or 3 times a day, they can use the appropriate deodorant, lotions, fragrances, and before the day is over, they cannot get rid of body odors. That is very embarrassing for some people to even bring up to the doctor. But I want you to know that some of these symptoms could be a symptom of a health issue going on in your body, and the earlier that the doctor can detect these health issues, the better your outcome will be. Number 5, digestive and urination problems. Digestive problems such as constipation all of the time, diarrhea, bloating, your stomach feels full all the time, nausea, or even vomiting. With urinary problems, a person can have burning when they urinate. Number 6 is substance abuse issue. People are embarrassed to speak to their doctor when they know they may be getting into substance abuse problems because they're self-medicating. They could be using old medication. They could be using too much medication if a doctor has given you pain medication in the past. So next, let's talk about some tips on how to talk to your doctor about some of these embarrassing issues. So one tip I have for you is when you are making an appointment, you can always tell the person what you want to see the doctor about. If it's still too embarrassing, be honest and open and say, hey, this is kind of personal, it's very embarrassing, but let the doctor know that I have a sensitive health concern that I'll be talking to him about when I get there. But will you please give me an appointment that will allow for more time for me to have this discussion? On the day or prior to your appointment, write down your health concern so you don't forget and you can stay on point. Number 3, when you arrive to your doctor's appointment, you know that from past experience that you will have a person that will take your vital signs or take your weight. It could be a registered nurse, it could be a licensed practical nurse, or it could be a medical assistant. Again, if you're feeling uncomfortable or you want to kind of break the ice with the doctor, you can tell that healthcare professional, hey, I want to talk to the doctor about a problem that I'm having, a sexual health issue that I'm having, or I'm having trouble with urinating, or I'm having trouble with constipation. You can tell them and they'll write down what your concern is, and that could better prepare the doctor. So when the doctor comes in the room to examine you, the doctor can start that conversation. The doctor can say something like, oh, okay, I see that you're here because you're having some trouble with painful intercourse. So the doctor will alleviate your fear and make you feel more comfortable in having that conversation because the doctor will be leading that conversation. Number 4, be honest, be direct, use simple terminology. You don't have to speak like a doctor. Number 5, if you don't understand what the doctor is saying to you, you can say, doctor, I don't understand. Can you repeat it? You can ask the doctor to speak to you like a 5th grader. I always say to the doctor, even though I'm a nurse, hey, doctor, talk to me like I'm a 5th grader. Put it in the most simple terms or words so I can understand it. Also, repeat what you think you've heard the doctor say. Number 6, if you feel more comfortable with a same-sex doctor, you can ask. Number 7, if you're feeling uncomfortable prior to your appointment, you can bring a friend or you can bring a family member to just maybe hold your hands, or sometimes they can start the conversation for you. And number 8, you can see a specialist. You can see a doctor who specializes in the problem that you are having. For example, if you're having problems with constipation, diarrhea, bloating, you can see a doctor who specializes in problems of the stomach. If you're having erectile dysfunction, you can see a doctor who specializes in problems of erectile dysfunction. So I hope this information that I provided today helps. Overall, I want to encourage you to overcome the barriers of being too embarrassed to speak to your doctor about these health concerns. If I have provided some value to you today, please subscribe to my channel, hit the like, leave a comment, and most importantly, share Nurse Marsha. Don't keep me for yourself. Bye.